welcome to Put the Shovel Down. This is our Facebook Live.
It's about having to take pain medication while in recovery.
And if you're new to us, I am Amber Hollingsworth, Master Addiction Counselor and founder of Hope for Family Recovery Center.
And I am David McNease. I'm founder of Greenville Transitions, which is a men's sober living here in Greenville, South Carolina.
And today your expertise, though, comes from something else.
Yes.
So you have to give your qualifications to speak on the subject.
Okay, so I am a person in recovery, 7 years, and recently I had to have a surgery. I had my tonsils removed, my adenoids, my deviated septum fixed, and they also did a thing called a turbinate reduction. So they pretty much just like cleared all of it.
They overhauled it all out in there.
They did it all at one time,
wow.
which that's how I wanted it. I didn't want to go back for multiple procedures.
Let me ask you this though, what were you addicted to?
That's a tough question. A lot of people would say I was a garbage can. That's what they called me. It was like whatever would alter my state of mind, I would take it.
Whatever you could get a hold of?
Whatever I could get a hold of. If I had alcohol that night, it was alcohol. If I had opiates, was probably like my number one love, was opiates and pain pills.
I think that's important here. I think it would be, not that it would be okay, but it'd be one thing if you're like alcoholic and then to take the pain meds. But for that to have been the drug, that's like even extra.
Yeah, that was definitely my number one.
Okay.
But yeah, like I said, I would take, if it were mushrooms would get me out of my head, I would, psychedelics, whatever.
Anything you could get.
Yeah.
So you're in recovery 7 years. Mm-hmm. Let me just completely tell you, in case you've not seen David's story on our YouTube channel, like, I know you don't believe it looking at him, but he was like a real drug addict. Like, for real. I mean it. Not like you're looking at him thinking, oh, whatever. No, for real. Watch his story if you don't believe me.
Pretty bad.
Legit.
Yeah.
Okay. So then you had to have this surgery and you get an entire overhaul.
Yes, and it was extremely painful. But let me back up and tell you how I started this process. So I started it 4 years ago by having a sleep study done, and the doctor's telling me you have to have work done. But I was terrified. I was like, man, they're going to try to give me pain medications. I don't know how I'll do with that. Mm-hmm. So it took me 4 years of like warming up to the idea of surgery and how I would deal with it. And then I started looking for doctors, and I started asking friends, family friends, people that they knew.
You were doctor shopping?
Yeah.
Doctor shopping.
But a different way.
Okay. Told on yourself now.
For the good doctor.
Of course, for the good doctor.
Yeah. But I ended up finding one that I knew he understood addiction. And he even had a son that was in recovery. So
you were actually shopping for, I'm teasing you, but you were shopping for someone that you knew understood recovery. Because one of the questions I asked David when we were getting ready for this, I was like, David, did you tell your doctor? I'm assuming you told your doctor recovery. And he said, yeah. And then you were saying, and he also understood recovery, which I think is a good point, because I have seen countless people, clients, like tell their doctor, like, oh yeah, like don't give me anything because I'm in recovery. And then like literally 5 minutes later, the doctor's like, well, take this Xanax, it'll help you calm down. I'm like, I've literally sat here with a client before and like called the doctor who she'd already told and said, like, no, this means you can't recover me this. Like,
yeah. And I went into this like saying I want to try to do this without any opiates. Maybe we could just try the Tylenol and ibuprofen.
You're gonna cowboy it up, huh?
Yeah.
You're gonna be tough.
And he told me, he said, you're gonna be absolutely miserable. Like that's gonna be hard. So we can try it, see how it goes. Like I'm willing to do that, but I will be on call if you need me to call something in.
You change your mind.
Yeah.
Because I've heard, like, you were telling me that, and my husband had that surgery like the year before, and it was bad. And Bree, I think, who works here, was saying it was bad. So I was kind of worried about you because I knew it was going to be bad. Yeah. If you've had that surgery, or you know someone's had that surgery, tell us in the comments. Give us an emoji that tells us just how bad that was. If you get smile faces, then you're going to look bad.
I will not get smiley faces. Okay. I know that for a fact. And with everything else it was the tonsils that were so bad. Like everything else, nothing bothered me.
Okay.
I didn't even feel any of the other pain because there was just so much pain right here in my throat where the tonsils were.
Is it just because it's like a sensitive area? What do you think that is? Why that surgery? Because I've literally heard like that is like when you're an adult and you get it, it's like bad.
Yeah, I guess so. A sensitive area, and like everything has to pass there. Any food, drink, hot, cold.
That's true.
It's going right past it.
right over
where the
wound.
incisions are.
Oh,
Yeah.
wow. Yep. Oh, that makes sense. Okay.
Yeah, looked around for a while, made sure I had a doctor that understood my situation. We were going to try it without pain medication or opiates, narcotics, and that lasted for all of 12 hours.
You were a tough cowboy for 12 hours.
12 hours.
Okay.
I made it. But after that, and luckily I stayed in the hospital overnight because my case was kind of serious, and they were like, we just want to see how you do the rest of the night. So I stayed there, hooked up to IVs, on fluids, and I told the nurse, all of the nurses knew. It was in my notes now at this point that he's in recovery.
He's
like
trying
a big
scarlet A on your file, like drug addict.
Yeah, it's like when you go to the bar and they put the big red X on your hand.
I
got that big red X on my forehead.
Yeah.
But so all the nurses knew. About 12 hours into it, I started asking. I was like, hey, I need something. This isn't cutting it for me.
Yeah.
And of course, they were just like, oh, well, here's an extra Tylenol. I'll just try this. And they were trying everything but pain medication. Mm-hmm. And it got to a point for me where I told them, I was like, I'm about to pull this IV out of my arm and I'm going to a pain clinic to get help because I can't deal with this.
So think about it. Like, you've had this person who, think about it, if you're not David, you're like the staff, the nurse, or whatever. And David has told you, like, I'm a drug addict. Don't give me no drugs. Like, whatever I say. And then all of a sudden, you're threatening. Like, now you look super med-seeking.
Yeah. But I think going into it, my doctor knew that was going to happen.
Yeah.
I think he knew
I was going to They probably had bets in the back. How long do you think it's
Yeah.
They probably were betting on you.
But once I said that, I finally got some medication that they just put in my...
threatened to throw a fit?
Yes. Once I threatened to just walk out of there in my gown, they finally gave me some medication. And that was a pretty scary moment for me because I believe it was Dilaudid that they put in my IV.
Now tell it to them like you told me in the kitchen.
Yeah.
I got scared when you told me in the kitchen 5 minutes ago.
So the reason I say it was scary is because I got some of those warm fuzzy feelings that I had when I was last using opiates.
That's not the way you told it to me.
I'm getting there. So how I told Amber, I was like, when you cuddle up in a blanket and you feel all comfortable and warm. It's like that, but for your insides. This warmth just surrounded my stomach.
There's the look.
Yeah.
Now you're seeing it.
The glow.
He was like, oh, it's like this, Amber. Yeah.
But it was, and my mom said I just looked over at her and giggled.
She's probably scared.
Scared to death, I'm sure.
Yeah.
But that was a scary moment, just having, that little flashback of, I mean, it wasn't like I got full on high. I was in so much pain, and I think that's often, people just think that you take it, you get high, but when you're in that much pain,
it just does its job.
It does its job. It just takes the edge off.
Right.
So I didn't get this full effect, but I did get this tiny flashback, and in my head I was like, oh shit, that's kind of scary.
Okay.
I like that.
I like that. I'm kind of scared I like that. Okay.
And then from that moment on, they started giving me these lidocaine. Like
the lollipop thing?
The lollipops, yeah, which didn't help me too much.
Okay.
And then they sent me home with liquid oxycodone to take.
Scary time.
Yeah. That I started taking in the hospital, and they sent me out with that. And I want to say that I think the most important thing I did going into this process was develop a plan.
Okay.
I did my work around a doctor that understood my situation. I wasn't in early recovery. I waited.
That's a really good point.
I was already, 3 years clean before I even started investigating my issues. And then I waited 4 more years.
Right.
I had some decent time under my belt.
I think that's important because I was telling David, I think if you're in early recovery and you need to have a surgery, if you really, really need to have it, then obviously you have to have it. But if it's something that can wait, I really think that is a pretty key factor because that could have super easily been a different outcome. On Caleb, on his story, when he talks about it online, and he was literally been sober 20 days and then appendix erupted.
Yeah, he took it like a champ. He thought he just had a sore stomach or something, if I remember correctly.
Well, he didn't take the pain meds like a champ.
Yeah, that's true.
Did not turn out well.
Yeah.
So if you can wait, definitely put it off. Not indefinitely, but until you feel solid. Because one of the things you were saying was you felt solid when you went into it, recovery-wise.
Yeah. And I'd also This is something I talked to my recovery community about. All of my support network, I had them coming by and checking on me once I got out of the hospital just to see how I'm doing, bringing me milkshakes over. It was awesome. I had a bunch of milkshakes. And then I had people to manage the medications to where I didn't even have to see them.
Okay.
I would have my mom dose that out, and I could have the oxycodone every 5 hours is when I could have it. But when I say you're not getting high, you're in so much pain, it would literally take the edge off enough to where I could sleep for 2 or 3 hours, and then I'm in pain waiting for that 5th hour to come around so I could, get some more sleep.
Does it feel like you're just watching the clock?
Yes, I'm in the beginning for sure.
Do you think your family and friends or your mom who was holding your medicine, do you think they were they could tell? I bet they could feel you watching the clock. Were you Mom, on the dot?
Oh, yeah.
I mean, I guess you didn't yell because you couldn't yell, but ring your bell or whatever you did.
Yeah.
Okay.
I would get irritated. I would get very irritated if my medication wasn't, because I was in so much pain.
Yeah, I know. Other people get irritated when they get their meds on time too.
Yeah. It was different in this case, I promise.
I'm meant for you.
But I was definitely that way in the past.
Okay.
But yeah, so I had people manage that. I had support network coming to check on me. I feel like a good plan around the whole thing. And then one of the last biggest things was, when do you stop? When's the time? And
now wait a second though, because with the tonsils, because I remember telling you, because this happened to my husband, but it gets better and then it gets worse.
Yeah.
There's so many days in, and I knew I'd heard that from my husband, and I'd heard that from other people, you think you're better. And I remember he had to call the doctor and get more pain meds. Did you have to get more pain meds?
I did. Yeah.
Okay. What were you how did you feel about making that phone call? Were you he's going to think I'm drug seeking? Were you worried about that?
I really I was in so much pain, I just didn't care.
You didn't care?
No,
okay.
I just wanted my medication.
And that's not like you, because you're always want to do the right thing.
Yeah.
You're always so polite.
Yeah.
Yeah, okay.
But I already don't do well with pain. I get the common cold and I'm freaking out. But this was a serious thing that it was very painful. And the reason that happens is you get better for a little while and then it gets worse, is scabs form and then they fall off. And then everything,
it can't be good.
Yeah, then the food, the drink,
open wounds,
everything's hitting it fresh again, to where it goes back to that initial first day of pain.
Oh man.
For me, it was around the 8 or 9 day,
I feel
7
that's
to 9 day
kind of
mark.
what I remember hearing. Yeah.
Yeah. So yeah, back in so much pain. I didn't really care what the doctor thought, what the nurses thought. It was call in a prescription.
Giving me some medicines.
Yeah, exactly.
Okay. Yeah.
But then, even when I got the second round of medication, it's I was strong enough in my recovery. I knew that I didn't want that around the house. I didn't want to keep it around. So it was about finding a time where I thought I could manage the pain that I was in with just Tylenol, ibuprofen, swapping them back and forth. You have to alternate those two.
But that's got to be a little bit hard, because, obviously if you're in pain, and even if you feel a little bit better, you got to be thinking but that could come back. Tomorrow I could feel worse again. And it's how do you know, it's hard. Well, I think when you're recovering, it's how do you know, is that your disease talking to you? That's got to be tough.
And I remember having that thought.
Okay.
And it was,
I think that's a normal thought.
Yeah. I remember thinking that, but what if it's worse when I wake up in the morning?
Yeah, because it had already been better and then gotten worse.
Yeah,
right.
And sometimes, when you wake up from sleep and the drainage, it would be more painful. But, you know me, I just I guess had the discipline to just be if it hurts, I've got to tough it out.
Okay.
It's just the last stretch, maybe 5 more days.
So you'd gotten the second, was it still the liquid stuff or whatever, second round of meds? And how much did you have at this point, do you know?
I have no clue.
Okay.
How much did I take?
Yeah, how much did you have left or whatever at this point?
Oh, probably a quarter of a bottle.
Okay.
Yeah.
Gotcha.
But I just knew, I set in stone in the beginning, the minute I could manage this, or I could sleep. It really boiled down to my sleep. If I could sleep for 5 or 6 hours without taking anything, then I considered myself okay.
Okay.
Or just off of Tylenol instead of serious pain medication.
Okay.
That's kind of how I weighed out the scenario. And the minute I got there, I just knew in my head, this isn't something I can keep around the house. It's got to go. So we dumped it down the drain. Like,
okay.
the minute I got to that point. And even though I was thinking, but what if it's worse in the morning?
Yeah.
It was like, oh well, I don't
Was
care.
it hard? Was it easy? Was it like a battle in your head? Anything?
Not really. I mean, it was pretty easy to do for me, yeah.
Did you feel vulnerable? Like, do you feel like if you wouldn't have dumped it, like if it would have just been there in the medicine cabinet or whatever, I don't know, you know, like...
Yeah.
Do you feel like that would have been a bad idea?
For sure, yeah.
For sure.
I mean, that's why I wanted it gone, is because it's
I saw the look in your eye when you said, I don't know if y'all saw it when he said for sure. I believed him. It's like right here.
Yeah.
You could see it. I saw it right there.
Yeah.
And you're like, definitely. Oh, yeah.
But, you know, that's just... I don't want stuff like that hanging around the house. Like, who knows? Like, if I had a really bad day or, you know, any excuse back when I was using, I would take anything. A good day, a bad day, a breakup, to use as an excuse.
Oh, yeah. A Wednesday, whatever.
So it's like, what could that look like? You know, I just didn't even want the temptation sitting around.
So you got, and that's like all you had left, and you're just like, get rid of it.
Yeah, other than like Tylenol PM.
Right.
To help me sleep. But
okay.
Yeah, that was the last of it.
And then how did you feel after the fact? Were you just fine, you moved on? Did you have second thoughts? Were you like, did you have any like I call them monster mouth
like
thoughts?
I shouldn't have dumped that?
Yeah, or like, did you have any like regrets?
No, I really didn't.
Or any like, I could probably call the doctor and get one more?
Yeah.
Did you have any thoughts like that?
No.
No?
Not at all. Yeah.
Okay.
Yeah, I feel like I did pretty good around that.
If you had thoughts like that, do you think the people around you, like, what do you think they would have done? Would they have known the difference? Would they have not? Like your supports, your family, friends, everybody?
I mean, I had too many people holding me accountable that were around me too much. Like,
you don't think you could have played them for another week or two?
Possibly. I don't know. It's hard to say.
It's hard to say.
Yeah, it's hard to like guess what could have been done. I guess if I think back to the old David, the manipulative, like when I was on tears, like, yeah, I could have done it. I would have found a way to do it. But like who I am today is a completely different, I like to think is a completely different person, you know, 7 years in just recovery than the person I was 7.5 years ago.
Definitely, yeah.
That was dishonest and deceitful. And
what questions do you guys have? If anybody's watching and you have questions, and even if you're not watching while we're on live here and you catch it after the fact, we'll go back, we'll look at the comments, David will go on there. If you have a question for him, he'll answer it. I guess, will you?
Yeah, I'll answer those.
He'll tell you.
And I've had a lot of people that are in recovery come up to me after that knew I had the surgery. They're like, man, how did it go? I need to have this surgery done. And I just want to say that, like, this was my experience. You know, everyone's different, and I can't say that, you know, your surgery would be harder or better than mine, but this was just like, these were my struggles and what I didn't struggle with, but like I feel like I had a very solid foundation with my recovery. I had a solid support network around me. I had people managing my medications. I had a good doctor who understood my situation. Like, there were a lot of pieces that I put in place to make this go well. And I guess what I'm trying to say is, like, I can't say whether you would have a more difficult time than I did taking pain medication.
This is like an AA meeting. This is not crosstalk. My experience was. Is that what's happening right here? Yeah. He's not cross-talking.
Yeah.
Okay.
So I didn't want, you know, it to be out there like, oh, well, I'll just go do mine too.
Right.
But look at all that was put in place to have a successful recovery from surgery. And
your recovery really was solid. And that doesn't mean, oh, your recovery solid, like, you can't be taken down. I mean, you obviously knew you were solid, but you knew you had enough vulnerability that you got rid of that medicine really quick. Right. So. And
I guess that always has to be in my mind, is like, anything can happen at any time. Like, I always have to, you know, be on alert. So. To
not get to the point where you think, I got this or whatever, it's gone.
Yeah.
Okay. Are you glad you did it?
100%.
Are you?
Oh yeah. I mean,
Tell them what you told me about the straws. That was kind of fun.
Yeah, it said that looking back, it, like, my whole life, it felt like now that I can experience something different, I felt like I was breathing through like coffee straws in my nose. And I told Amber, I was like, now it's like the big McDonald's, like McFlurry straws. Like, I've got an airway now.
Your
just
brain,
sucking it in.
Your brain's probably working better than
like, you remember Kirby? I feel like Kirby, the pink. video game guy.
Oh,
you know,
yeah.
Kirby?
I know Kirby. But why do you feel like him? Like, I know it. Like,
his superpowers, he would like suck in so much air.
I didn't know. Oh, yeah, that's right.
Yeah.
I've seen him on the Mario, like, fight each other thing.
Yeah,
Okay.
Super Smash Brothers.
Super Smash Brothers. Yeah. Okay. I gotcha. So you're like, I can breathe. I
can finally breathe. And my whole life, I just thought I had really bad allergies.
Mm-hmm.
Like, and I would take allergy medication, and it still wouldn't really fix the problem.
It's the same. It was the same thing as my husband. He had almost the exact same thing as you have.
And
Yeah.
I'm sleeping better. I have more energy. I wake up faster in the mornings. It's just, I'm really glad I did it.
So what you're saying is, in your experience,
In my experience.
it can be done, but you do need to really think the situation through. And it's not just what surgery you have and what supports do you have, what doctor do you have. And I think probably most importantly, it's like, how strong do you feel in your recovery? And I've had a lot of friends in recovery that will do certain things, even if it's like put themselves in a higher situation. You know, they might go to, you know, the family reunion where there's going to be drinking 1 year and feel totally fine with it, and the next year later not, because maybe there's something going on in their life. So I think you really have to, you know, I think recovery requires a lot of self-honesty. And so you got to really check in with yourself, like, can I handle it? But one of the things you were saying is like you had no reservations.
Yes.
Yeah.
Going into it.
And reservation is kind of a recovery word. So say what that means in case someone's like, what do you mean reservations? Like, had no like dinner reservations? What does that mean?
No, so like reservations to use or drink. I had no thoughts of like, oh, well, I could use this surgery as a way to like maybe get high one time and just see. I mean, you hear about that a lot in relapses, is that, you know, they had this reservation that like, oh, I'm gonna,
like this certain circumstance in their mind, it'd be okay. Like if this one thing ever happened, like I've heard a lot of clients say like, man, if I make it to 80, you know, like it's you know, I've heard different things. Or
if
like,
I make it to New Year's in 2022, like I'm gonna drink them.
Well, if I lost my husband, you know, there's like this thing in the back of their head is like, if this one thing happened, then it'd be on.
I hear if I win the lottery one a lot.
Is it? You hear the lottery one? I hear the like old one a lot.
I don't have anything to worry about, and I'm going on a tear.
Okay. Their money be gone so fast.
Yeah, I know.
It'd be over.
Yep.
Okay.
But so that's basically a reservation, and I can honestly say that I didn't have any of those going into this. It was like I wanted to fix my problems that were going on. I wanted to sleep better.
Now, you may not know the answer to this, but I was kind of thinking when you were talking, like, because, you know, we have so many families and stuff that watch, like, let's say you're the caretaker, you're, like, the loved one of the family member who's trying to, like, take care of someone. Is there any way at all to know the difference in drug-seeking behavior and, like, seriously, I'm in pain behavior? Like, because I don't know. I mean, I wouldn't know.
Yeah, I don't think there would be. Because I can't tell you how many times I manipulated my parents into
like
thinking that
like, even if it were me, I'm, like, a trained addiction counselor, I really wouldn't know.
Yeah,
I don't think you could totally trick me if you wanted to.
Yeah.
Yeah.
And I think I could have tricked anyone that I wanted to. Yeah.
Okay.
That'd be a tough thing to.
Because I mean, it's like with the real life excuse. I mean, it's like it's like you're gonna look at you and be like, you're lying when you know he just had his tonsils ripped out.
Yeah.
It's tough.
Maybe we should buy a lie detector test.
You think?
Maybe.
We could have those. They're called urine screens. We have them. Any advice that you would have for family members, support people, anybody like that, to do, to not do, to think about, anything like that?
Yeah, pretty much just what I've touched on, to make sure your plan is in place and that it's a solid plan. Also, wait until you're comfortable in your recovery.
Like family recovery, you mean?
For the support.
Yeah, for the support.
Yeah, I guess just, question, like, come from a place of concern and make sure your loved one has a solid plan. And now you have like a checklist, some things that I told you that I did to kind of go by and make sure that they have in place. But from there, it's kind of, they've got to be honest with themselves. It's kind of out of your hands. Like, it was out of my mom's hands.
Did anyone ever like question you or, like look at you with the doubtful eyes? Like, did you perceive that? No sketch affirmation?
Not at all. I can remember like having buddies come over and like I would just joke with them about it and be like, hey Zach, I know some of my oxycodone's missing. What'd you do? Like, And he'd freak out like, what are you talking about? I didn't touch it.
So you messed with them.
I would mess with them, but no, I don't think I ever had anyone like think that I was.
You know, you can feel when someone's kind
Yeah.
of like giving you the like.
Yeah, I didn't feel that at all.
Okay. All right. Well, thanks for hanging out with us. If you know someone who might get benefit with this video, please share it out. Our goal with our videos is always to help you understand the psychology of addiction, because even though addiction is a disease and we talk a lot about the biology part's not really that hard to beat, honestly. You can get off any drug you want to in 5 days. Like, we take you off anything in 5 days. It's the psychology. I think that's a lot of what we focus on in here, is like what's going on in the mind of the person with this problem. Because if you can understand it, that's the one good thing about addiction, is it's super predictable. And if you can understand what you're dealing with, you can know what's coming next and you can stay ahead of it. And that's for whether you're in recovery, like you are staying ahead of it by knowing I could have this thought or this could happen and I'm going to stay 5 steps ahead. And the family can too. So if you know someone who needs this, share it out. And other than that, we'll see you next time.
Thanks for having me.
Bye, guys.